All right, it's Thursday, time for our Team Kentucky update. We normally start our Team Kentucky update with talking about the good news, but the Delta variant is so severe, its pace so alarming, that we're going to start today by giving our update on where we are with this variant. First, it is a fact that it is the most aggressive, and it looks like it may be the deadliest form of COVID that we have faced. If you are unvaccinated, you are at the greatest risk that you have been since the very start of this pandemic. COVID has been the third leading cause of death in the United States over the last year and a half. Think about that. It means it's given cancer and heart disease a run for their money. You would protect yourself from those conditions to the extent you can. You need to protect yourself from this. And the pressure that it is putting on our healthcare heroes and the healthcare capacity that we must have is significant. Folks, we have gone in the course of a month from 200 cases of COVID to nearly 3,000. That is 1 month. We started this journey talking about Philadelphia versus St. Louis. And we've done a better job in Kentucky, with maybe the exception of this last winter, of being like or better than St. Louis. But our current exponential rise looks a whole lot like Philadelphia. And remember, that comes with a lot of loss and a lot of death. What we are seeing just to the south, which we always see first, we saw it last summer, we've seen it at other times, ought to be ringing alarm bells throughout this commonwealth. Let's start with Mississippi. Look at that headline. Mississippi hospital system could fail. Fail. That is not be there for the citizens, for those in need. The state of Mississippi has just asked the federal government for that big medical boat that we saw in New York when field hospitals were in Central Park and when people died at such a fast rate, they lost more in that first round of COVID, that first spike early on, than they even did in 9/11. We never thought we'd see ourselves at a point like that again, yet here is the newest request. And it's not just in Mississippi. We talked about Arkansas, 8 empty ICU beds for the entire state. Now, folks, when a hospital fills up, if you have COVID, that's going to be tough. But if you've had a heart attack, if you've had a stroke, if you were in a car accident, if you fall and hurt yourself very badly, if you were harmed, your ability to get treatment can be dramatically impacted. So please get vaccinated. Failure to get vaccinated, failure to wear a mask could mean that there is not a bed available for you or your family if you're in a car accident tomorrow or the next day. Surely we can do these little things that ensure that our healthcare heroes and the staff are there for you, no matter if you believe in COVID or not, and is there to help anybody who's harmed. Again, around the country and here in Kentucky, we also see that this is impacting more and more and more children. Those that have been critical of steps and the right steps that I had to take earlier this week, none of them have acknowledged how quickly this is spreading, and none of them have acknowledged we have more cases in children and we have more admissions of kids, more kids in the ICU than ever before. That is highly concerning, and it's something that we should all want to take active steps towards. You can only do the right thing to save people if you can first admit the fact that they are in danger. So today, to talk about what we are seeing in Kentucky, we continue to invite some of our amazing healthcare heroes to share about the things, oftentimes the horrors that they've seen. Our doctors, our nurses have been our lifeline in this. They've been a real lifeline, trying to fight for the health and survival of our people And they've also been a substitute for families, holding the hand of those that are hurting, those that are scared, and even those that are passing away. I'm going to tell you, we owed it to our healthcare heroes to have defeated this thing by now. We owe it to them to get vaccinated so that they don't have to spend days and nights and days and nights and days and nights fighting our plague. So let's make sure that we honor them by doing the right thing, by getting that vaccine and by masking up when we are outside of the home and indoors. So today we have Cindy Lucchese, who is the Chief Nurse Executive of U of L Physicians, to talk just a little bit about what she is seeing day in and day out. Cindy, first, on behalf of the Commonwealth of Kentucky, we cannot express our gratitude enough. Thank you for being one of our heroes, fighting on the front lines. And please tell everyone you work with how much we care for them, how much we love them, to stay strong because we still need you.
Thank you, Governor. I'm honored to speak to the citizens of Kentucky today about how the COVID-19 virus is currently impacting healthcare. And while I wish I could share a more positive message and tell you we're winning the war against this virus, that is just not true. Currently, we are seeing an increase of COVID-19 patients in our own healthcare system and across the state. Today, U of L Health has 4 times the number of COVID positive inpatients than we did just last month. And right now in our hospitals, nurses across the Commonwealth are leaving their families to take care of yours. We've been called healthcare heroes, but I believe I speak for many nurses when I say we aren't heroes. We're just doing what we've been trained to do, and that is to take care and provide quality care for all those that need us, even when that means we are working and putting our own health at risk at the front line of a global pandemic. Many think only the elderly and those with underlying health conditions will experience complications from this virus. Well, that's not the case. And with the emergence of the Delta variant, we are seeing younger and healthier people become very sick. And that includes pediatric patients. Some are children under the age of 12 who cannot yet be protected by a vaccine. As the number of COVID patients increase, our hospital systems across the country could be overwhelmed, and we're seeing that. It's impacting our ability to care for all patients. And the citizens of Kentucky, they depend on us to be able to handle emergencies, car accidents, strokes, and heart attacks. And we will be there, but we're worried. And we see the number of infections rising every day from this virus. Kentucky, I'm here to ask for your help. Only around 50% of eligible Kentuckians have received the vaccine. It's just not good enough. If you're waiting and you're questioning the safety of this vaccine because it's not yet FDA approved, I urge you to reconsider. Time is not on our side in this war against COVID-19. And maybe you're healthy today and you think you'll survive a COVID infection. Chances are you might, because the evidence is out there and it supports you have a good chance. But are you willing to take that chance? And the fact is, if you become infected, you can spread this virus to those that are more vulnerable. And that's just a chance we should not take. The virus is not giving up. It's mutating, which has resulted in a more contagious and dangerous Delta variant. And currently we are seeing an increase of cases among our citizens that have been vaccinated. And you might hear that and think that means the vaccine's not working. So why should I get it? Well, the truth is, the mass majority of patients that are in our hospitals have not received the COVID vaccine. And while none of our current vaccines are 100% effective, they are safe and effective to provide protection from hospitalization and complications of this virus. And that is why we are urging you to continue to wear your mask and to get the vaccine as soon as possible to help stop the spread. You may still be hesitant and have questions, and maybe I've not convinced you to protect yourself and those around you. And if that's the case, I ask that you reach out to your healthcare professional, the physician that you depend on for your health and wellness, the one that you trust so that you can get trusted information about the vaccine. So I will end this by saying, we wanted you to hear from a bedside nurse today. But as stated previously, our hospitals are very busy. And right now, a nurse is caring for a COVID patient, a patient that waited, even though we've had these vaccines available for many months now. They still decided to wait. But we will be here to take care of you, Kentucky, regardless of your decision to wait, and we will do everything in our power to save you from the virus. And we hope and pray that we're not too late. Thank you.
Powerful and emotional words that I hope reach those that need to hear them the most. I remember standing here many months ago, asking our nurses to have the courage to walk into COVID wings without the PPE they deserved and needed to fully protect them. Now they're asking us to have the empathy for them and their fellow human being to get the vaccine and to wear a mask. Given all they've done for us, it's a very small thing we're being asked to do for them. Next up, we're going to take you to Ashland, Boyd County, Carter County, Greenup County area with a report from King's Daughter. We have Dr. Stacy Caudle, Hospital Director and Chief Medical Officer, and Dr. Joshua Bryant, Hospitalist at King's Daughter. They're going to tell you what they're seeing.
The Chief Medical Officers and Hospitalist Director here at King's Daughters Medical Center.
And I'm Dr. Josh Bryant. I'm one of the hospitalists here at King's Daughters.
We were asked to share some of our experiences that we are currently having with COVID-19. Here at King's Daughters, we had an initial surge around the holiday season of Christmas and New Year's. We saw a positivity rate of that time in our service area of about 16%. That was the max that we had gotten to. At that point in time, we had 90 COVID admissions and 5 COVID units. We have noticed over the past several weeks that our positivity has now increased to 14%, which is the second highest that we have seen since we have entered this pandemic. This has been a steadily increase from about a month and a half ago of 2 to 4%, and a significant rise. We started out with just a few patients, and now we are up to 48 current admissions. Our COVID ICU is currently full, and we've opened a 4th COVID unit. One of the things that we've noticed is, whereas before, when I told you that positivity rate was a max of 16%, about 12 to 13% of those were pediatric patients, being defined as less than 18 years old. We are now seeing that to be about 25% of our cases as it stands now. We have seen in the month of July an increase in admissions, and in the month of August, we've already seen more admissions than we did in all of July. I think our total is up in the 60s for our current admissions to date. One of the most important things that we've seen with this round of COVID is that our age of admission has significantly decreased. In our first surge, we noticed an elderly population. In our service area, we do have a lot of patients over the age of 65 that have been vaccinated, but we are still struggling with those less than 65. Currently, I think Greenup and Boyd County are around 40% vaccination rate. So we are seeing our average age of admission that back in January was around 75 that has now dropped to 55. We have noticed the same with our mortalities. Of our current admissions in the hospital, 94% of those are unvaccinated. 100% of our ICU patients are unvaccinated. Dr. Bryant is the hospitalist that is currently seeing our patients, in the COVID ICU, and I wanted him to share a little bit of his experiences with you guys.
Thank you. Just like Dr. Cottle said, we have seen a big shift in demographics for the patients admitted to the COVID ICU. What I'm seeing currently is, predominantly people 40s, 50s, and 60s that are very, very critically ill. Currently, all the patients in the COVID ICU are unvaccinated, and for the last month and a half or so, with the surge that seems to coincide with the Delta variant, what we've been seeing is a big uptick in overall deaths in patients that are, of a younger age. Part of what's difficult is when you're dealing with patients at this age that are critically ill and you're discussing kind of what led to this, it's difficult not to discuss the possibility of why they weren't vaccinated. And what we're seeing is a lot of regret from patients and family members that they chose not to vaccinate and are now dealing with some pretty dire health consequences when it's really too late to implement any changes at that point. So from our standpoint, the things that we're seeing are most of these deaths are very preventable. There's a lot of long-term illness and disability that we're seeing that's very preventable. And the best things that we can really promote that are going to make that change are vaccinations, masking, and social distancing. And so that's kind of what we're here to talk about and recommend.
I want a couple of things that were said in that video to echo. Our COVID unit is full. We have opened a fourth COVID unit. Average age of cases going from 75 to 55. That's average. That means there are just as many younger as older. And they said their mortality data, ages of people that are dying, is doing the same. I don't know if you could see it, but I could see the exhaustion and the pain in their eyes. Again, we owe it to them, fighting every single day, oftentimes fighting for those that refuse to make the right decision, Never too late to do the right thing. All right, we're going to continue to hear from folks around the state. I think this is important, that people hear from those in their area what's going on, because oftentimes you could say, well, that's somewhere else. I've had some folks on school decisions saying, well, I've got local data. Well, COVID isn't any different in your area than it is anywhere else right now. It's all Delta variant, and it's filling up every hospital. So next we've got Dr. William Milan, Chief Medical Officer of St. Clair Regional Medical Center. He's going to tell you all their beds are full.
My name is Will Milan. I am the Chief Medical Officer at St. Clair Healthcare in Moorhead, and we are experiencing the most rapid rise of cases that I've seen since the pandemic started. We are seeing a lot more hospitalized patients. We are currently in the process of opening what we call a surge intensive care unit, because our usual intensive care unit is full, and it is full with a lot of COVID patients, and we need more room. We also have a lot of patients who are not as critically ill, but also in the hospital. We are at a record, I believe, in terms of how many patients we have. We're also seeing a lot of patients in the emergency department with COVID, more than we've seen in a long time. One thing that we've seen this time that's different is it seems like they're sicker. We have almost no vaccinated patients in the hospital. Almost all of our patients that have been ill have been unvaccinated. For a lot of reasons, unfortunately, don't have enough vaccine adoption in our area. So the majority of our population is actually not vaccinated still. So I think that's why we're seeing such a steep increase. We have amazing nurses, we have amazing physicians, but they're really wearing out. So far, we're hanging in there. I think I'm speaking for all of the hospitals across the state in saying that we're worn out, but we're not going to give up. But if you really want to help us, go get vaccinated. Vaccination is extraordinarily safe. We've not seen anybody in our emergency room with a vaccine complication, but we've seen, I don't know how many COVID patients who have not been vaccinated.
Our ICU is full. If you want to help us out, go get vaccinated. Cases continue to rise. We expect this week to have more cases than we did last week. Having nearly 3,000 cases yesterday, expect we'll probably surpass that today. It's something we never thought we would see again in this pandemic. You know, we can show our overall stair-stepper chart again. It shows you just part of the way through the week that we are looking at numbers that are even worse than the week before. And we keep trying to show, you know, what's happening over 2 weeks, doubling hospitalizations, doubling of cases. We talk about what we've done over a month, going from 200 to nearly 3,000 cases. Just those are daily cases. Why don't we look at the last 6 weeks? That's June 29th to August the 8th. Now let's look at this one. So 6 weeks ago, in the course of a week, and week before this, we'd had even less. We had 1,135 cases in a week. That's 6 weeks ago, right? That's a month and a half ago. We had fewer cases in the entire week a month and a half ago than we had yesterday. Actually, yesterday, we had 2 times more cases than we had in the entire week 6 weeks ago. So week over week, in 6 weeks, we've gone from 1,135 cases to 14,000. 13,903. It's real. If you are not vaccinated, it's coming for you. We want to protect you. We want to stop it from spreading. We want to stop it from killing people. Please get vaccinated. And everything we are hearing from our hospitals, we're seeing in our data. Let's show again the graphs. I mean, I've never had a line graph that's worried me more than the inpatient census. Look, remember Philadelphia versus St. Louis? How we try to push it down? That line looks a whole lot like Philadelphia, doesn't it? Almost straight up. And you might say, well, that's just people in the hospital. First of all, if you're in the hospital, you're pretty sick. I don't know how many people have been actually in the hospital for days at a time for different things in their life, but it's a pretty serious deal. But how about the intensive care unit, which is full at St. Clair and filling up other places? So you hear him talk about surge. They're creating a surge area. That's when we were putting up our field hospitals. They're doing their plan for their field hospital right now. And finally, people on a ventilator. That number, that line, going up pretty fast too. And that's at the point where you're not just hoping, you're praying every moment that that individual is in there, that they can get better. And I can't tell you how many stories here in Kentucky and we see across the country where as they're about to intubate that person, and I think they know when they see that coming, exactly how serious it is and what their odds might be, just begging to be vaccinated and hearing it's too late. But there is a defense, an armor that can prevent that for you and everybody else. There's a way we could defeat this adversary. We could defeat it tomorrow. We could end COVID tomorrow if everybody would get vaccinated. We could turn that line in 2 weeks from one that's almost going straight up and down to being at fully zero. I want you to think about that because we're at war. We've lost more people than any 2 wars in Kentucky's history put together. We can end it tomorrow. I'm not sure that's ever been the case in human history before. And all we have to do is get vaccinated. And vaccinations are up. They're not up enough. And between yesterday and today, 5,589 new Kentuckians getting vaccinated. And if we break down the ages, really, the one that matters that I want people to see is the total 18 years and older went up 1%. We're now to 65%. That's of adults. That was driven by the 40 to 49-year-olds, but again, nowhere near enough. Now, those 65 and up that have done the best out of us, that's incredible. But if you're that 16%, oh my goodness, please go out and get vaccinated as quickly as you can. You thought the last COVID took people that we love who are older at a fast rate. That 16% is more at risk than ever before. We got a group of heroes here today that I know prayed for a vaccine as hard as they could. They were working for our Office of Kentucky Veteran Centers. They were working specifically at Thompson Hood Veterans Center. I've had hard days standing up here, reading about deaths, telling people we don't have enough testing, telling people I haven't been able to find that N95 mask they deserve. One of the hardest things I've had to talk about is the number of veterans that we lost at Thompson Hood. It was tragic. But folks, I was just standing up here. Folks you're about to meet, we're fighting to save them. We're comforting them. We're talking to the person who may have had that room next to them, that knew them, that was spending their twilight years with so many individuals that we lost. So today, we're now going to hear from some very special people that I think will tell you if their folks that they were taking care of, would have had the chance at that vaccine, they would have taken it so quickly, they would have still been here today. We can honor their legacy and those that have served by getting vaccinated. So we have Martha Workman, Deputy Executive Director of the Office of Kentucky Veteran Centers. We have Joni Gosser, Administrator at Thompson Hood Veteran Center. And we have Katie Gross, Nurse Executive at Thompson Hood Veteran Center. Y'all are phenomenal. We can't thank you enough.
Hello, my name is Martha Workman, and I'm the Deputy Executive Director for the Office of Kentucky Veteran Centers. Governor, I'd like to thank you very much for inviting us to be able to tell our story, and hopefully it will help others come to understand how important it is to get vaccinated. The Kentucky Department of Veterans Affairs operates the 4 veteran centers across our state. They are skilled nursing facilities, and all of our facilities have been affected by this war that we are engaged in to fight this pandemic, but none more so than Thompson Hood. Across our centers, our goal has been always, one, to obtain the vaccine, which we were able to start doing in December of 2021. And then also to get 100% vaccination among our veterans that we serve and our staff. Our veterans who have served in World War II, Korea, Vietnam, who've served our country, that's just who they are and what they do. Most of them were asking, when can I get a vaccine? They looked at it as simply another way for them to continue to serve and be of service. Our staff stepped up, and they also have been getting vaccinated. I'm happy to tell you today, across our veteran centers, our veterans, we are at 94.5% vaccination rate for our veterans. Our staff is at 71.75%. And I'm also happy to report that this week alone, we've had 18 additional staff step up and get their first vaccination. Plus, we've had 2 more veterans who have done that. Our approach to this is it's all about relationships, we're finding. We have to get people to where they have a secure sense and can make an informed decision about the vaccine. A vaccine, by the way, that we have had no repercussions from among our staff or our veterans to speak of. So our veterans deserve to be safe in our facilities. And I'm happy to report that since the vaccinations started in December, we have had no veteran in our centers contract COVID. How we do it now is one conversation at a time with our staff. We've created videos, we've created brochures. Our medical directors are answering any kind of questions that our staff need. Our infection preventionists are tirelessly talking with staff about and having critical conversations with our staff in order to be able to help them make informed decisions. But I think that how we can best explain the need for people across the Commonwealth to continue to get vaccinated is for Thompson Hood's story to be told. And no one can tell that better than the 2 amazing leaders that I have flanking me, Joni Gosser, the administrator, and Katie Gross, who is our nurse executive there. They led the battle and fought the fight as we tried to keep COVID out of our facility, and then as we had to endure and come out on the other side and start the vaccination process. So Katie and Joni, if you'll come forward and share your story.
Thank you all. Thompson Hood Veterans Center held our first COVID preparedness meeting February 23rd, 2020. This was far earlier than anybody in the United States was having COVID talks in nursing homes, I'm sure. And for many months after that meeting, we cleaned, we disinfected, and we sanitized, and we applied social distancing. We screened every visitor, staff, and that entered our building. We tested routinely our visitors, our staff, and our residents. We monitored anybody that came in our building for COVID symptoms, and we wore appropriate PPE throughout this time. Eventually, we, like every other facility in the state, had to restrict our visitors, so we had to lock the facility totally down. And all during this time, our facility staff bravely held the line, and we went for months without having one case of COVID. But last fall, when the community started to surge with COVID cases, COVID finally was able to breach our facility. And I was just the administrator, but Katie Gross, our nurse executive, she's the true hero. And I want to let her tell you what she experienced.
Thank you, Joni. Thank you all for letting us come today and share our story. The thing that we learned last year as a community, the world, once COVID enters a long-term care or a community living facility, where we're home to an already immunocompromised elderly population, it becomes all but impossible to stop. And that is what we experienced at Thompson Hood, despite our best efforts. Initially, we began with one hallway dedicated as our COVID zone, and then we had to add another and another. In total, during our outbreak, 98 of our veterans were diagnosed with COVID, and 99 of our staff members, my heroes, contracted COVID while caring for those veterans on the front lines. We and the rest of the healthcare world, hospitals, clinics, anyone who had any dealings with COVID as a healthcare worker, we were stretched incredibly thin. We were exhausted. Exhausted really was an understatement. It's indescribable. Nurses and nursing assistants, housekeepers, dietary workers, people worked around the clock in full PPE. People slept at the facility. People were away from their families for days and weeks. We were worn out and we were scared. I want to share a story if I can. People that live in nursing homes, they become like your family. They live there long term because their own families can't take care of them. And our staff, especially last year, but always, serves as family to those people. Last fall during our outbreak, something that we did regularly, just continuously, was check our lab site for COVID results constantly. Do we have any more positives? Do we have any more positives? And get action plans in place. So I'll never forget checking that website and seeing one of my friends, my dear veterans, a World War II veteran who served in the Pacific. I saw his name pop up red, and I just got a sick feeling in my stomach. He was in his 90s and had comorbidities, and I just thought, oh my goodness. So I wanted to be there with them to tell him that he had COVID and to transfer him over to one of our red zones. I just wanted to be there with him. So I went up, PPE'd up, and entered his room to tell him. And I told him, and initially the thing he was most worried about at first was his fish. His name, it was Old Red, was the name of his little beta fish. See, in 2020, it was incredibly lonely for people in nursing homes, despite our very best efforts on trying to keep them engaged and entertained. But so one of the things we did to combat that is get some of our veterans' little beta fish. Joni got it for him. Old Red. So we said, okay, I'll go wherever you want. We'll transfer. I'll go to another room. Just don't forget Old Red. Don't spill Old Red. And we're trying to push him. And the CNA's got his fish in the fish bowl. And so as we make our way over, I think the gravity, I think it set in. I think he realized what was happening. And so we approached the zipper wall and then another zipper wall to enter our COVID unit. And I'll never forget, he looked back at me and said, "You're taking me to death row. People come in here and they don't come out. These people in these rooms, they're not gonna live. They're gonna die. I'm gonna die." And I did my best. I reassured him, the staff around me, you're going to be okay. It's okay. You're going to be fine. We're just going to come over here for a couple weeks and then you're going to come back and you're going to have your fish and it's going to be fine. But in his case, it wasn't. He's one of the veterans on our memorial board that we lost during COVID last year. That's just one of many, many stories and people that we loved that we lost. In total, COVID claimed the lives of 34 of our veterans. And as Martha said, they served in World War II, Korea, Vietnam, Gulf War, Iraq. Finally, on December 22nd, we finally got our vaccine. We had our first clinic after months of battling losses, funerals, and victories, COVID graduation parties when people recovered. We finally got our shot. One of my favorite moments from that day was one of our 106-year-old veterans. He's a Navy veteran named Chester. He rolled up his sleeve to get vaccinated. He was so ready. He wanted to be the first person. It just reminded me when men and women join the military, basic training, they roll up their sleeve, they get their vaccinations, ready to serve, ready to fight. And that was no different. Our 106-year-old little veteran, he was ready to go, ready to protect himself and all of the staff and his fellow veterans. And Martha, as she said, I'm so grateful to share that we've had no more positives since that vaccination clinic. I'm going to be honest, we're all anxiously watching and waiting and praying, and we see the surge in the community now with a much more dangerous Delta variant. It's eerily reminiscent of last year. This time, though, it's different. This time we have a weapon that we didn't have last year, that we prayed for last year, we dreamed of. The death and the pain is preventable. The school closures, the business closures, nursing home shutdowns, all of it is preventable this time. We've been nurses for a long time, This isn't something that's political. It's about humanity, honestly. We do not have to needlessly suffer through a round 2 of this. We can get back to normal. And I can speak for the healthcare community around the Commonwealth, probably around the world. We just urge everyone, please do your part. Help us to fight this battle and to win this war so we can be done and we can go back to normal. So just continue to wear your masks, to social distance, and please, if you haven't already, please consider getting your vaccination. Thank you.
Wow. Thank you. And thank you to everybody you work with. Can we not get vaccinated to prevent this type of loss from occurring again? Can we not follow the example of the 106-year-old willing to roll up their sleeve? Listen, he wasn't worried the vaccine was going to hurt him. Why should any of the rest of us? This is one of the most tragic sets of losses that I've seen in my life, and certainly in my time as governor. And it doesn't have to happen again. But if we don't do our part, get vaccinated, wear a mask, we can and we could see something like this again. So your community, your country, your veterans are asking you to do the right thing. Be a patriot, make the right decision. Okay, we talk about why we're doing this. We talk about the 3 goals that we have, that getting vaccinated and then masking while we need to will help us serve. Let's put them up again. Let's remember what we're doing. We're trying to save lives, protect health, make sure we don't lose any more veterans, any more Kentuckians, so we don't have kids going in to an ICU. Remember the doctor today talked about the long-term impacts of COVID too. It's not just death. It causes a lot of harm. The second is we want our kids in the classroom learning. That's why I took that step, requiring masks, K through 12, and in childcare. And I believe the Kentucky Board of Education just voted to have an e-reg unanimously that says the same. We have to do it. We saw the schools that are doing it. They're doing great. Kids are doing great. It's almost a normal year except for a piece of cloth. Schools that aren't, 700 kids in quarantine after 3 days. Pass-fail exam, one passed, the other failed. We can't have people following an example of failure. Number 3, continued economic resurgence. So at the beginning of this, our lives were going to be turned upside down. We weren't sure what the loss was going to be outside of lives, outside of normalcy. We didn't know what the economy would look like. Well, an economy that they worried would take 5+ years to come back, would never be the same, is surging at a rate I've never seen before, with job availability in Kentucky that I've never seen before. It was just 2 weeks ago that we announced the single largest investment in Western Kentucky in 25 years coming out of a pandemic. Fact is, we got a better shot moving forward, us, right here in Kentucky, to be something big, to be something special, to never be looked down upon again, to not go to some big city and then they say, where are you from? Say Kentucky, and they say, no. We got a chance to be something incredible. And I think we always have been. But to be seen all across this country as a leader, things like agri-tech, to be a leader in the industries of tomorrow. I mean, that announcement we made 2 weeks ago is going to be the cleanest, greenest, most technically advanced recycled paper mill in the world. Right there in Henderson, right here in Kentucky. And so to continue that, we have to win this battle against COVID-19. Getting vaccinated is also important to so many of our industries that have been disproportionately impacted. Hospitality, restaurants, and here in Kentucky, I want to talk today a little bit about tourism, because we talk to each other as Kentuckians and we love our state. I mean, when you see somebody in the airport coming home from somewhere and they're from Kentucky, oh my goodness, you sit down, you talk about where we've been, but most especially where we're going back to, how much we love home. And the natural beauty of Kentucky And the tourism opportunities we have from Red River Gorge to Bourbon are ones that the rest of the world is truly seeing. It serves as an economic driver to every single one of our communities. We're home to 45 state parks spanning over 48,000 acres throughout the Commonwealth. And a few of those parks even stepped up in the midst of COVID and provided housing for those that needed it. They also play a significant role in generating revenue for communities. And so while the pandemic may have slowed economic progress across the board, our tourism sector remained resilient. Despite the challenges posed by COVID-19, visitor trips to the Commonwealth reached 67.8 million in 2020, with visitor spending totaling $5.9 billion. Overall economic impact of the tourism industry in Kentucky for 2020, that's our COVID year, $8.9 billion, and generated 75,655 jobs across the Commonwealth. We remain committed to making sure that tourism makes it through this, to make sure that we are ready to thrive. So in May, we announced that Kentucky received nearly $3.6 million in federal funding to support recovery for our state's tourism program. We committed $5 million in federal CARES Act money to Kentucky tourism to prime the industry for further growth and to help get us through. But in order for us to be a leader in the post-COVID economy, we got to invest in tourism and get through this virus. And we've had some big announcements just this last week. In partnership with the Muhlenberg County Tourism Commission, Kentucky State Parks celebrated the grand opening of the Big Twigs, a family of 14 tall wood giants that'll become welcome park guests. This is the newest tourism attraction at Lake Malone State Park. And folks, right now, this is outdoors. You can have that mask off. You can have that mask off. You can enjoy, be around there with your family, be around there with your friends. And the second one was pretty special to me. On Monday, I had the honor of joining the family and former teammates of the late University of Kentucky golfer Cullen Brown, as well as members of the Lyon County and Lake Barkley communities, to pay tribute to the Eddyville native who we lost a little over a year ago from a rare form of bone cancer. To celebrate Cullen's life, the golf course at Mineral Mound State Park was officially renamed the Cullen at Mineral Mound to honor his legacy and the incredible impact he had both on and off the course. And I will tell you, even after his passing, he had an impact that day on me. I was weighing decisions that I was going to need to make that next day to protect our families, knowing that there'd be blowback. And his dad told me, I'm not sure what it was in response to, that if I ever wondered what I should do, Cullen would have said, you should do the right thing. So I want to invite Tourism, Arts, and Heritage Cabinet Secretary Mike Berry to share some additional details about Vax and Visit Kentucky initiative, the Commonwealth's latest effort to encourage Kentuckians to receive their shot of hope and participate and help save, help thrive, help grow our tourism industry. Secretary Berry.
Thank you, Governor. It's an honor and a pleasure to be here today to share a new initiative that the Tourism, Arts, and Heritage Cabinet is launching to further help the Commonwealth defeat this pandemic. Under the Governor's leadership, Kentucky has been recognized as a national leader for the Commonwealth's efforts to protect the health and safety of not only Kentuckians, but our visitors as well. As a result, in a recent study, 60% of travelers who came to Kentucky in 2020 reported that they viewed Kentucky as a safe destination. The recovery of the tourism industry in Kentucky began in the fourth quarter of 2020, while many surrounding states did not experience the start of recovery until much later. The economic recovery that we've experienced is directly related to the precautions that we took as a state to prevent the spread of the COVID-19 virus. These efforts, along with the Commonwealth's abundance of outdoor recreation opportunities, allowed Kentuckians as well as our guests to safely travel while continuing to social distance. The array of services provided by our cabinet and our tourism partners have created opportunities for us to provide necessary resources that have positioned the Commonwealth at an advantage for defeating the pandemic. So today we're taking those efforts a step further, and we're launching a new Vaccine Visit Kentucky initiative, the Commonwealth's latest efforts to encourage Kentuckians to receive their shot of hope. As part of the ongoing efforts to prevent the spread of COVID-19, Kentucky will offer in-state travel incentives at Kentucky state parks for Kentuckians who have received their COVID-19 vaccination. Now, incentives will include golf rounds, overnight lodging at some of our resort parks, as well as gift certificates for camping, which has been one of the major economic drivers for our state parks throughout the pandemic. So beginning today, eligible Kentuckians who have received their shot of hope can register for a chance to win a safecation at a Kentucky state park. Kentuckians 18 years of age and older who have received at least their first dose of Moderna or Pfizer vaccine or the one-dose Johnson & Johnson vaccine may enter to win one of 30 drawings. Safecation gift certificates will include overnights and golf at Dale Hollow, Pennyroyal, Lake Barkley, Barron River, or Kentucky Dam Village State Resort Parks. Golf rounds with a cart at any of our 13 state park golf courses, and overnight stays at any of our 30 state park campgrounds. Gift certificates are limited to one per winner, and blackout dates may apply. So entry begins today. Drawings will occur weekly beginning September 9th. 10 winners will be selected for each drawing, and the final drawing will take place on Thursday, October 7th, 2021. Winners will be posted on the Tourism, Arts, and Heritage Facebook, Twitter, Instagram, social media sites, as well as the Cabinet's website, tah.ky.gov. For details about how folks can win a chance to visit a Kentucky State Park for doing your part to protect your fellow Kentuckians and our guests, you can learn more by visiting tah.ky.gov. Thank you, Governor.
That's awesome. I mean, just by doing the right thing, you can get out and do all the things we want to do, all the things we enjoy doing. But I can't let you upstage me because we still have one more drawing for $1 million for someone willing to be vaccinated here in Kentucky. You have about 2 weeks left before our last drawing for a shot of hope. We're going to have one new Kentucky millionaire. Surprising these folks has been really fun. It's been really exciting to see how their lives are going to change, but both individuals did it because it was the right thing to do. And they said in that moment, all we did was the right thing to do. And each one has been willing to step forward to ask other people to get vaccinated. And 5 of our youth here in Kentucky, under 18, will win a free college education. I ran into one of them, Addison, who was at the Cullen naming. And just her story is so exciting. Had plans to maybe do something else, now going to go to the University of Kentucky. So excited to see where she's going to go. We showed a commercial that she shot for us. You know, her words, I think, are more powerful than mine could ever been. And it's truly amazing seeing what this opportunity can mean for young people. So if you've already been vaccinated, sign up. You do not have to sign up again if you signed up for the first drawing or for the second, but you got 2 weeks. You got a deadly variant out there. You need to get vaccinated to protect yourself, and you could win. All right. And finally, today, we continue to see incredible job growth across Kentucky. Opportunities that can transform this state forever, and a good reason to continue to fight this variant to come out on the other side in a special place. I want to recognize a major Kentucky employer that continues to grow its presence in our state. Yesterday, Amazon announced the start of operations at its air cargo hub at the Cincinnati Northern Kentucky International Airport in Hebron. This thing, if you haven't seen it, is incredible. It is huge. And it shows you the scope of this operation. At least at the time that it was being built, I think it was the single largest investment, one investment that Amazon had ever made. It's been in the works for quite some time. And yesterday's announcement signifies the realization, not just construction, but operation. The Amazon Air Hub includes a $1.5 billion investment. It's with a B, creating more than 2,000 jobs at the Northern Kentucky facility, and I think they're just getting started. It's huge news for our state, as the distribution and logistics sector is one of our greatest strengths. And every single one of those 2,000 individuals going to be working in this facility is going to be wearing a mask, because Amazon is doing the right thing. The same thing that we're doing to protect their workforce by what we're doing in schools, they are doing inside their facilities. So this facility is Kentucky's third major air cargo hub. I don't know if anybody else in the country can claim that. And it'll add significantly to the nearly 80,000 people already employed by distribution and logistics companies across the state. This is an 800,000 square foot operation located on more than 600 acres. It is gigantic, and it's going to process millions of packages each week. Kentucky is the ideal location for logistics. Just ask Amazon, ask UPS, ask so many DHL, and so many other groups that are setting up here. Year to date, we've seen more than 65 new location expansion announcements, which are bringing $2.6 billion into the Commonwealth, creating over 5,500 full-time jobs. In the past 12 months, distribution and logistics companies alone have announced 2,000 new jobs. That's in 1 year, one sector, 2,000 new jobs, and nearly $285 million in private investment. I want to thank Amazon for believing in us, for helping us to transform an airport I used to fly into, it being Delta's second biggest one at the time, helping to transform a community, betting on us here in Kentucky, one of the biggest companies in the world. That's pretty special to see. And Amazon wasn't the only logistics company to celebrate a milestone this year. Quality Logistics LLC, better known as Longship, was founded in Lexington nearly a decade ago, but it has grown and grown and grown. Company started with one double-wide trailer transporting produce throughout the U.S. Now Longship operates a network of 400,000 trucks. One double-wide trailer to 400,000 trucks in 10 years is pretty impressive. They operate in Lexington and Nashville, supporting a wide range of industries with transportation of fresh, frozen, and dry shipments. Yesterday, it cut the ribbon on its new $4.3 million office in Fayette County, a project that's creating 155 new jobs. At an hourly wage of $28 an hour, including benefits, they're well-paying jobs for the folks in Lexington and the surrounding regions. Longship's relocating from its previous location on Newtown Pike to a 29,000 square foot space on Sir Barton Way. The move's a big step for the company and its leaders. I want to thank the company's leadership, including founder Kenny Ray Shump, for building on Longship's well-established roots in our state. From this Lexington native, I hope that we will see it continue. Let me just close on our economic development announcements that this isn't just thrilling. This is an economy on fire, growing faster than just about everywhere else, giving us more opportunity than we could have ever dreamed of. So if you're a person that is worried about the workforce and maybe even grumbled about it the last couple of weeks for different reasons, if we don't do our part to defeat COVID-19, we're going to give up the best shot at being the best version of ourselves that we have seen in decades. So I need your help, whether it's to keep kids in school, to save lives, or to continue an economy on fire. I need you to get vaccinated, and I need you to wear a mask while this surge is going on. Finally, I want to recognize, our Team Kentucky All-Stars. And these are the folks that, even before that tough decision I had to make on Tuesday, were already doing the right thing. First, our mask mandate in our schools and in our daycares is the right thing to do. We cannot send unmasked, unvaccinated kids in a poorly ventilated room day after day after day. That is not protecting them. Doesn't matter how we feel. It's about them. Remember, kids are not our property, our chattel. They are our solemn obligation, and we owe a duty to all of them for their protection. So while I know it was the right decision, I want you to know a whole lot of people had made it before we had to do it statewide. And remember, the Kentucky Board of Education just agreed unanimously. I want to applaud the first school leaders who chose to require masks during the Delta surge before there was an executive order. And it took courage. It did. You see some videos from some other places around the country, and people have lost their mind outside school board meetings, getting in people's face, telling them we'll find you. That is not who we are as Americans. We don't threaten one another. And if you are outside a school board meeting being a bully, your kids are watching. 45 school systems plus made the decision on universal masking before Tuesday, including the one that I went to, Fayette County Public Schools. But I want to give a special shout out today to a school system that's pretty important to me, Dawson Springs Independent Schools, without which we would not have Steve Beshear. It's one of the first school districts to require masks this fall, a full week before the statewide executive order was signed. And I know right now, this might be a tough decision, was a tough decision to make in Hopkins County, a county I love. This was the right thing to do. This is showing courage and leadership. The superintendent, the teachers, the principals, everybody working in that building. We're willing for people to be mad and upset at them because they were doing the right thing and they knew it for the kids inside that building. I'm so proud of you. So proud of you. And I'm so proud of every other school system. This is just one example that was stepping up and doing it right. Kids are safer because of you. You are living up to your calling, and we couldn't be more proud. All right, with that, we will open it up to questions. I know we have a number of people virtually. We'll take the time that we need, and as I try to find the list, we'll just start with who's here. So, Joe?
To the Kentucky Board of Education's decision to approve the mask mandate for schools, for every school district in the state. And, another question is, where are your thoughts at in regards to implementing more restrictions? I know you talked about the school mask mandate being really, the big one this past a couple of weeks here, but, cases are rising, hospitalizations rising, ICUs are rising. Heard a lot of people talking today about that being a difficulty. Where are you at with the thought about more restrictions?
So the Kentucky Board of Education today did the right thing. In a unanimous decision, they stood up for the safety of kids, and they, being the board charged with education here in the Commonwealth, coming from all different places and all different backgrounds, did the right thing. So that'll mean that there's not just the executive order, but an emergency regulation out there. So every school system, you need to be following this. Those that are trying to find a way out, just remember, you're facing the same COVID as everybody else, but you're ignoring the CDC, you're ignoring the State Department of Public Health, you're ignoring your local health director, you're ignoring an executive order, and you're ignoring a regulation from the Kentucky Department of Education. When someone gets hurt, and they will, if you are refusing to do the right thing, good luck. I think you'll be held accountable. Tom Latek.
Thank you, Governor. COVID memorial there, and just wondering what's the latest status? Can you update us on the memorial that will be going up here on the Capitol grounds?
Yeah, we're working on a permanent memorial to have here at the Capitol grounds. When you're going to lose more than 7,400 Kentuckians, one of the most difficult parts of our life, we need a permanent monument recognizing the sacrifice and the loss. We have it down to a group of finalists. Each of them is receiving a stipend to put together what their vision would look like. It looks like we have secured the funding that will be necessary for the monument from healthcare systems all across Kentucky that want to make sure that this moment is remembered for the heroism of their staff and their people. All right, we have Stu Johnson on virtually.
All right, Governor. Okay, Governor, got me?
I can
Thank you. I appreciate it. Very good. you mentioned earlier in this briefing that 589 people have been vaccinated over the last day. What's been the rate of vaccination over the last week? Has it been flat, 5%, 10% increase over the last week?
So if we look at, let me start with 2 weeks ago versus what we have seen, a month ago versus the last 2 weeks, we've really seen a doubling in that period. Now, right now, I believe that doubling is holding steady. I don't yet think that we are seeing a growth on top of that. But again, it's somewhat early. What we see during the week is we have numbers come in, and then a whole lot of them are reported at the very end of the week. So on Mondays or Tuesdays, we'll have 13, 18, 22,000 come in at a time. And we were going, until shot at 1 million, we were going down week after week after week. And then we stabilized. And from where we were then, we've jumped, it's about 1.8, 1.85 times where we were. But today's number is good. Today's number is a bit higher than we were seeing the last couple of days. I didn't answer, I realized, Joe's second question because he snuck a second one in. That's that we'll do what's necessary to protect our people. But we do not have to have any shutdown ever again. We do not and should not have to have any capacity restrictions again. Because if people are willing to do the right thing, maskings plus vaccinations can keep us safe. And guess what? If everybody get vaccinated, we wouldn't even need the masking. So anybody who doesn't like the masking that is not vaccinated, I'm sorry, pal, you're the reason. And we really need you to come around and get that vaccine. Lauren Adams.
Good afternoon, Governor. We have people money. We have tried to elicit their emotions by talking to folks that are in healthcare for all the right reasons and have had to watch people die and hold their hands. At what point do we, I don't want to say threaten, but tell people, hey, we're going to have to shut down X, Y, and Z, because that seemed to get the attention of a lot of Kentuckians, unfortunately. Is that the next step to kind of get people to wake up?
So we are seeing more people get vaccinated. I think the next step is calling on the people of Kentucky, which we've been doing. So you've had folks like me, governors and others, asking people to get vaccinated. You've had folks like Dr. Stack, public health experts and local health directors asking people to get vaccinated. You had ministers and rabbis asking people, faith leaders, to get vaccinated. You've had local officials. You've had many local officials asking people to get vaccinated. We've had doctors, local practitioners asking people to get vaccinated. We're to the point where in a war, when we need everybody doing their effort, we're down to asking people to have some uncomfortable conversations. You know, when I think about my faith and loving your neighbor as yourself, that's even when you've got to do something, maybe will make your neighbor not like you as much. And that's talking to them about this vaccine. If you know people that haven't gotten vaccinated yet, I need you to have a personal conversation with them. It's going to be uncomfortable, probably not going to be happy, but they know you. They know you personally. And this might be the difference between them getting the worst sickness of their life and possibly not even being here. And we're down to the point where those personal relationships, which we heard about, matter so much. The next thing that I think we're going to continue to see are employers. We saw our hospital system step up. Their folks are going to have to get vaccinated. It looks like our armed forces, you have to get a ton of other vaccines, are going to require the vaccination. And I think when we get full FDA approval, you'll see a lot more of that coming. But I hope people out there aren't using FDA approval as an excuse and they're going to switch to another excuse, because half the population's gotten this thing and we're all fine. Actually, we're better than fine. We're protected. Again, if we could find the magic words, I would use them. And if we could find that thing that works to get everybody else vaccinated, we would do it. But we will continue to work. Josh James, WUKY, who is on virtually.
Hi, Governor. Thanks. Talking about hospital staffing, Texas Governor Abbott has directed state officials to use staffing agencies to find additional medical staff from outside the state. Is there anything Kentucky can do at this point to ease the the burden on hospitals facing shortages? And at the same time, are those efforts going on in other states draining staff from Kentucky at this point?
Well, it would really concern me if a state wasn't willing to take the mitigation efforts that we are, that they then try to go out and get hospital staff from other states. That would seemingly put other states at risk. Currently, our goal is to use our mitigation efforts to make sure our hospitals are not overrun. Let me level with you. Our hospitals may get full even with the steps that we're taking. This Delta variant is that serious. We are going to see a lot of loss moving forward, but I think we can lessen that loss and protect each other. And again, if everybody went out and got vaccinated tomorrow, and we could vaccinate a whole lot of the state that's not vaccinated in a day or in a week, we wouldn't have to be worrying about that possibility. Sarah Ladd from the Courier-Journal.
Yes, thank you. So as schools are going back to class, how will the state track any cases or outbreaks in schools? Will the self-reporting dashboard come back, or are we looking at something else entirely there? Thanks so much.
We haven't brought the self-reporting dashboard back, in part because the local health departments are doing a really good job. And for the most part, the schools have been pretty transparent about it. You know, let me give credit for even the schools that tried to go back without masking. When there was an outbreak, they did the right thing. And I want to be supportive of doing the right thing. And they were open and honest with the information. So that's important. And we're seeing that because the local health department will require it too. If we believe that the information is not getting out in the way that it needs to, we may well bring back that dashboard. But listen, I know I was critical of and I still am, of school districts that weren't willing to do the right thing. Now they got an excuse. Blame me. Hold whatever meeting you want. Just follow the order to protect the kids. I'm not worried about the fallout, even if you are. But I believe that what we have seen on the real positive side is a level of transparency that's important and has been there. And our local health departments are very focused on our school systems, and they regularly work with them anyways. Michelle, who has now tested me, shoved something up my nose probably 100 times in the course of this, works with the school system here in Franklin County. Bria Jones, WFPL.
Yes. Do we have any information about what's going on with breakthrough cases? I know that those will make up a huge percentage, but for folks who are vaccinated or who are unvaccinated, using that as an excuse, is Kentucky holding any data about breakthrough cases, or is that something that's more CDC focused?
So I would look at the CDC breakthrough generally, but there is a challenge with the data on breakthrough cases. First of all, the CDC is only tracking ones that lead to serious illness and hospitalization. So there are people who've been vaccinated that are positive, that we might in a vernacular call breakthrough cases. They're not being tracked by the CDC. So there are there are a number of folks that are out there that aren't experiencing anything because the vaccines work that well, that may be positive and may be spreading it. That's why we're wearing the mask. That's why we're doing the right thing there. And then on our breakthrough cases, we have more challenges with that data and getting that data in. It's a little bit intensive. The local health department has to ask a lot of questions, and that's definitely imperfect. I believe as we move forward, we're going to see that more people who've been vaccinated are positive than we ever thought. The Delta variant's doing that, but they are well protected. So we'll have a higher rate of positives of people who are vaccinated, but you won't have many that are in the hospital or who die, and we're thankful for that. It's now becoming the type of vaccine that we're normally used to, that keep us from being harmed, but maybe don't keep us from getting it. Melissa Patrick, Kentucky Health News.
Hi, Governor. Did you wait too long to institute this universal school mask mandate, as Republicans have suggested, and were you reluctant to get back into this pandemic mode?
I haven't seen a Republican say I should have done the universal masking in schools earlier. I would love to talk to that person. Maybe we can have them come up to this press conference and they can support it too. I mean, then we'd be getting somewhere. Did I wait too long? I wanted to give local leaders the chance to do the right thing. More than 44 of them did during that period. We also saw every university come out for it. We saw our hospital systems come together to require vaccines. And I think that's important because in those 44 school districts, it's somebody that they know that was saying it before I stepped in. We certainly did it before most districts went back to school, and we certainly did it after we saw some very concerning results from those that were making it optional, which meant people weren't wearing it. Listen, those that are criticizing, none of them talk about how serious the virus is. None of them are talking about how serious the Delta variant is. None of them are talking about hospitalizations, and none of them, when they get a microphone, are saying, please, 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 please get vaccinated. And that means they're sowing at least misinformation or confusion, or they're making coverage that's out there. I mean, media coverage, which we need to say, please get vaccinated, looks what's happening to the hospitals as, well, Andy Beshear says this, but Republican leader Y says that. That doesn't help us, right? That just makes it red or blue. And it shouldn't be red or blue. It's life or death. So I got a question here about, please react to the Attorney General's legal challenge to the school mask mandate. Well, man, if he wins, we're having a statewide chickenpox party with the third leading cause of death. That's his award if he wins. I mean, come on, folks. I know I said this early on. I guess the answer is no, but can we not put politics and power aside to do the right thing, even when it comes to our kids? I've got a child that's unvaccinated that would be in one of those classrooms. And I know a lot of other people do too. All we're asking is for people to do the right thing. Question, did I consider calling a special session? Well, that would have taken a week plus, and we've seen what their opinions are out there on masking. Actually, many of them said they wouldn't wear a mask in the Capitol building itself. You simply can't make these decisions or expect a courageous decision from 100+ people. It doesn't work that way. I'm willing to take the heat. I'm willing to do the right thing, and I'm going to continue to. And you see in states that have come together, that have had these types of sessions, they've even removed the authority of local units to require masking in schools. And that is crazy. All right. WHAS, I think we have somebody on virtually. Oh, they dropped. Okay, just a couple more. In Marshall County, the superintendent sent out a letter saying the district sought legal counsel, and they're going to follow House Bill 1 instead of the executive order. Well, it's not just an executive order. It's not just Board of Education having voted on it. It's not just the CDC saying you need to do it or your kids are in danger. It's not just the state saying you need to do it or your kids are in danger. It's not just the local health department saying you need to do it or your kids are in danger. It's not just the Kentucky Chamber of Commerce saying you need to do it or you're going to decimate our workforce. But House Bill 1 has been enjoined. It is not in authority from the Franklin Circuit Court. And what many times folks like this will do is just send them a different court ruling and not give everybody the full information. But again, fully unvaccinated kids in, sadly, a county where we need to get more people vaccinated in the height of the Delta variant is a recipe for disaster. And if you go against every single public health recommendation, if you go against every state requirement, and you do the wrong thing, because it is the wrong thing for those kids, I mean, God help you with what the consequences are going to be. And I don't know what they'll be. Hurt families. We've lost bus drivers in other parts of the state, teachers. I can't imagine from my previous life the liability. Please, just do the right thing. You've got cover now. Just do the right thing. Do you believe House Bill 1 gives school districts the basis to override executive orders? No. And remember, House Bill 1 said you got to follow the CDC. CDC says masking in all schools, right? This isn't just, I'm going to follow House Bill 1. It's, I'm going to say I'm going to follow House Bill 1 to not do what's in it. Legislature said the CDC, what it recommended would be law and we'd have to do it. But now apparently are not willing to follow that. Other states are starting to cancel elective surgeries and looking at reopening field hospitals. We don't think we are at the field hospital stage yet. but we got a whole lot of hospitals that are canceling elective surgeries. That's where we are. A hospital won't do that unless it is really, really serious. All right, folks, I know we've gone long today, but we're at a serious place. Listen, get vaccinated to save the lives of those around you. Get vaccinated so we can keep our kids in school. And if enough of you get vaccinated, we can take off the masks. Get vaccinated because we got a chance to be more than many of us ever thought was possible here in Kentucky. Something really special. There's a right thing and a wrong thing. Getting vaccinated, wearing a mask to protect each other is the right thing. Thank you all very much.
He's an author, a filmmaker, a former policy advisor to Ronald Reagan.
He's a best-selling author, political commentator, and filmmaker.
Joining us now, best-selling author, creator of Hillary's America.
He's been described as an influential conservative thinker.
And a guy who really, really doesn't like Hillary Clinton.
Who's quite accustomed